Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Fetal Alcohol Syndrome. Introduction. Fetal Alcohol Syndrome, or FAS, is a condition caused by exposure to alcohol during pregnancy. Fetal Alcohol Syndrome, or FAS, can happen when women drink alcohol during pregnancy. Children with FAS may have physical deformities, intellectual disability, learning disorders, vision difficulties, and behavioral challenges. This program explains fetal alcohol syndrome. It discusses the effects of drinking alcohol when pregnant, symptoms of the disorder, and treatment options. Pregnancy and alcohol. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. They include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. When a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to expand a lot. During pregnancy, the baby is in a special fluid called amniotic fluid. The baby and amniotic fluid are in a bag called the amniotic sac inside the uterus. The baby gets nutrition from the placenta. The placenta is an organ between the amniotic sac and the uterus. It grows with the baby during pregnancy. The mother's blood delivers oxygen and nutrients to the baby's blood through the placenta. The mother's blood also removes waste from the baby's blood through the placenta. If you drink alcohol while pregnant, the alcohol can enter the blood of the developing baby through the placenta. A pregnant woman's body can process and break down the toxins in alcohol faster than a fetus can. That means that the alcohol concentration in a baby's blood will be higher than that of an adult. This can prevent nutrients and oxygen from reaching the baby's organs and cause brain or organ damage. Drinking alcohol during pregnancy can cause miscarriage, or the death of a fetus before the 20th week of pregnancy, stillbirth, or the death of a fetus after the 20th week of pregnancy, fetal alcohol spectrum disorders, or FASDs. Fetal alcohol syndrome, or FAS, is the most serious type of FASD. Women who are pregnant or might become pregnant should not drink any alcohol. The more a woman drinks, the greater the risk of damage to the fetus. Substance abuse counseling may be helpful in some situations. Symptoms. The problems caused by FAS vary from child to child, but the problems are irreversible. This means they cannot be cured. FAS is a common cause of intellectual disability and learning disorders. Fetal alcohol syndrome can cause abnormal facial features, such as narrow and wide-set eyes. Children with FAS may have a narrow upper lip and short nose. They may not have the typical ridge on the skin just below the nose and above the top lip. FAS can also lead to birth defects, including small head and brain, or problems with the eyes, ears, joints, limbs, or heart. Children with FAS may grow more slowly. They may also have developmental problems, such as limited attention span, nervousness, or anxiety. They may be overly active or impulsive. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. Fetal alcohol syndrome cannot be diagnosed until after birth. Tell your child's healthcare provider if you drank alcohol while pregnant and how much. If you are a foster parent or adoptive parent, you may not know if your child's biological mother drank alcohol while pregnant. Talk with your child's healthcare providers so that the underlying cause of any learning and behavioral problems can be identified. Treatments. There is no cure for fetal alcohol syndrome. Symptoms are generally lifelong, but treating them may help. Your healthcare provider may be able to offer resources and support. They can monitor your child for problems as the child grows. Special care is needed for babies with fetal alcohol syndrome. Certain foods and tags on clothing may bother them. They may become overstimulated easily by noises, lights, and touch. Try to avoid situations that would overwhelm your baby. Soothe them in a dark and quiet place. Your baby may have problems feeding. They may need to eat more often and use a special bottle. Continue talking and reading to your child. Playing and interacting with them helps them bond with you. It can help them develop physical, mental, emotional, and social skills. Routines, structure, and rewards for positive behavior are often helpful. Your child may need special assistance in school. Children with FAS are more vulnerable and may be taken advantage of. Providing a safe and nurturing home environment can help protect your child. Choose babysitters carefully. A counselor can also help your child work through issues, overcome challenges, and build essential life skills.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Fetal alcohol syndrome, or FAS, is a condition caused by exposure to alcohol during pregnancy. Children with FAS may have physical deformities, intellectual disability, learning disorders, vision difficulties, and behavioral challenges. Special care is needed for babies with fetal alcohol syndrome. Certain foods and tags on clothing may bother them. They may become overstimulated easily by noises, lights, and touch. Try to avoid situations that would overwhelm your baby. Soothe them in a dark and quiet place. There is no cure for fetal alcohol syndrome. Symptoms are generally lifelong, but treating them may help. Your healthcare provider may be able to offer resources and support. They can monitor your child for problems as the child grows. Continue talking and reading to your child. Playing and interacting with them helps them bond with you. It can help them develop physical, mental, emotional, and social skills. Routines, structure, and rewards for positive behavior are often helpful. Providing a safe and nurturing home environment can help protect your child. Thank you for using Explain.